Exciting natural results where you can see the difference. The team from MD Hair Labs is here. Thank you so much for joining us today.
Of course. Glad to be here.
Let's do quick introductions. Let people know who you are. Let's start with you, Dr. Clifton.
I'm Dr. Missy Clifton. I'm a board-certified dermatologist and laser surgeon. I work with the MD Hair Labs team, and also on Premier Dermatology and Aesthetics.
I'm Dr. James Ragland, board-certified head and neck surgeon and one of the surgeons at MD Hair Labs.
Talk to us about how the hair restoration industry and how MD Hair Labs is really changing the game.
Well, there's a lot in the hair restoration industry now. Lots of things that people in Northwest Arkansas really don't even know about. So people who lose their hair for a multitude of reasons. Sometimes it's stress, sometimes it's actual hormonal or genetic reasons that they lose their hair. Sometimes it's after COVID. So there's lots of reasons, and we actually have a team of people who can help you figure out why that's happening. We also have a genetic test.
Okay.
That can tell you exactly what's happening and what medications and supplements you might need or you might really benefit from.
Okay.
And then there are people who are really losing a lot of their hair from what's called androgenetic alopecia. And those people we can actually do hair transplant on.
Oh, wow. Okay, so you just dropped a lot there. Let's talk about some of the hair loss procedures that people can experience when they come to MD Hair Labs.
Most of the procedures we do are on men who have naturally, as you can imagine, lost a lot of hair or little hair at almost any age. But one of the things we also do is eyebrow transplants, and we have Jenny here today who had one of those recently, but we do all kinds of hair restoration procedures.
So if a client is worried about their hair loss, what's kind of the first step in trying to figure out if they need to work with you or not? Do they come in and do a consult and you let them know kind of what's going on?
Yes.
Okay.
Yes. So you come in for a complimentary consultation. We sit down, we do a hair metrics analysis where we actually take pictures of the hair and count hairs per square centimeter. So it's very scientific. And then we take a history and see if there's a family history or if there's a history of medical issues that may be contributing to that. And then once we get that figured out, we can proceed, if we want to, even more in depth with that genetic test, or we can talk about all of the other options. So we do platelet-rich plasma treatments.
Okay.
We do exosome treatments. We do lots of things beyond transplant, depending on the severity and the cause of the hair loss.
Sure. And Jeannie, you received a eyebrow transplant?
I did. You did.
Walk us through that. What is that exactly?
Well, I'll let you explain what it is exactly, and then I can tell you what it felt like for me as a patient.
So Jenny was like many people who have either lost eyebrows just over time or had gone through and things had been plucked and removed, or a lot of times they just gradually fade down. And so we're able to take hair from areas that you have extra to give at the back underneath here. We take a little strip of skin that has the hair in it and sew that back up, and you never see it again. And those hairs are then dissected out and placed exactly where you need them. And she had previous microblading and pigmenting here, so we really just went right along pretty much where she had wanted things.
Okay.
And you implant and transplant those living hairs into the eyebrow, giving you natural existing hairs of your own, just like they should be.
Wow. To your point, Dr. Clifton, very scientific.
Yes.
Jenny, how was the experience for you?
It was great. I mean, actually just going in and just relaxing, watching Netflix. They did all the work. I did kind of show them the shape that I like.
Okay.
And then he came in with his artistic ability and helped me shape them even more. And I mean, painless, just comfortable.
Okay.
A little sore afterwards, but medication helps, and then just letting the process happen.
Okay, so if I come in with a picture of Beyonce's eyebrows, we can
We can do it.
work that out,
do
Dr.
that.
Ragland?
Absolutely.
Okay, stay after the show. We'll chat. If someone out there and they're very interested and they want to learn more about the work that you all are doing at MD Hair Labs, how can they do that?
So they can go online at mdhairlabs.com, or they can give us a call.
Anything else people need to know as they're researching, or are there any kind of frequently asked questions that you all may receive at the clinic that we can answer really quick on air?
Many things are about recovery time and things like that, and recovery time is kind of however long you want to be out from the view of people, but generally probably week and a half, maybe 2 weeks, depending on how worried you are about what people see.
Okay.
But it
Was
heals
that
up really
your
quick.
experience?
I mean, I took off the next day, and then I went back, and I looked like I had just either had them permanent makeup on them, or I looked like I colored them in. They were easy. I love them.
Awesome. I think we do have some information if you want to reach out to the team at MD Hair Labs. There it is right there on your screen. Thank you all so much for joining us today. We appreciate you.
Thank you.